We don't want to say like, okay, the main focus is how do we make money, but I think the main focus is how do we make enough money that our practice is never in jeopardy. And, if you've paid your staff and all of a sudden 3 kiddos had lost coverage and their families had lost coverage, that's a really hard situation to be in, right? You don't want to put that unexpected expense on the families.
Right, especially
and you
if
may have to eat it.
Yes.
Yeah. Especially if it takes you months
to figure it out.
Find out.
Yes. And so we have AMAs a couple of times a month, and we had a customer where
each one.
Yes.
I don't think a single AMA has passed that someone hasn't shared a story
I
about.
think that she was out $70,000. So, what do you do? Right. And she's still trying to figure out what they did wrong, and they're going back and forth with this funder. And so it's heartbreaking, right? For everyone involved, because the BCBA doesn't want to put this burden on the family and the stress of that situation, right? Like, nobody's got $70,000 sitting in their bank account, right? Like, at least not many people. It's just, and then you're like trying to keep services going because, again, most BCBAs, they just want to help kids, right? Like that's all they want to do. And so there's that feeling of I can't drop this case even though I'm not getting paid. It's really difficult.
And I do. That's definitely a huge deal. I don't think anyone here thinks that just like, oh, I could lose tens of thousands of dollars or even more and be okay with that. I'll just eat this.
Can I have a job?
Yeah, right. But even like the more that I'm digging into like the coaching piece of things and helping business owners like to learn how to delegate, as what we're finding, a lot of business owners, those first couple of years are like wearing all the hats and they're like the full grind, right? And working, I don't know how many ungodly amount of hours a week, because like that's what you do when you're building a business. But then they find themselves still at that spot 3 and 4 and 5 and 6 and 10 and 12 years into their company, and they're still running off of that same just pure like
startup
adrenaline and straw. Yeah, on this exactly. And so I've been working with a lot of owners to try to figure out, okay, where can we delegate? What can we let go of? What do we want to do? What do we not want to do? And the first thing on the list is taking a time audit. Like, let's take 2 weeks. Just jot down in whatever format you want how you're spending your time, even if it's a very minimal, tiny thing, right? Up to a big time spender, right? Just every little thing, write it down. And the amount of time that's spent on just what do you call it? What are you calling it? Administrative burden. Yeah, I like that. But the amount of time spent on that, I don't know either. You probably got it from somebody's podcast.
Probably.
Is just. I don't have data on it yet. Like, I really want to like start some kind of research project on this, because it's got to be real outside of our field too, but especially in our field, looking at it's over half of their time is just busy work. I don't want to call it busy work. Checking the boxes, but necessary boxes to check so that you can get paid and your staff can get paid and all of the things. But I'm just wondering like how much time you save. I don't know if you guys have done any kind of audits within SILNA of like just even some of the basics of this work, like how much time is saved using SILNA. I don't know. Have you guys done anything like that?
We have, yeah.
Oh,
and
okay.
It's fascinating. You think about just healthcare more broadly. It's a $5 trillion industry within the U.S. Latest estimates is roughly $500 billion is spent every year in just excess healthcare administration waste. Yeah. So almost 1/10, right? And the biggest bucket of that spend is billing and insurance related. And so, you think about this time audit and becoming a leader in the business. I think in the early days, you wear, to your point, 15 hats and you do whatever you can to get that off the ground. And then at some point, it becomes really hard to make the transition of how do you go from working in the business to on the business? Yep. And, I think it's a death by 1,000 cuts. It's very easy for me to look at where the pain point is in SILNA today that's the most acute, and let me go and try to figure that out. But it's much harder for me to say, what's the small thing that may not even be on my radar, or when it happens, I don't think it's a huge deal. But when I think about it more holistically, that's actually the thing that's really pulling my system down and not letting us move as quickly on that end. And so we ran a couple case studies with some customers in ABA that said for Medicaid, they were spending 30 minutes per prior authorization.
Yeah.
For commercial, they were spending roughly 90. For TRICARE, they were spending 2.7 hours. And
that sounds
you start
right.
to think about,
Yeah.
That's just prior authorizations.
Yes.
Yeah.
And, I think that the hardest part here is you go and do a calendar audit of the last 2 weeks, and there's a good chance what didn't pop up in those 2 weeks was what happened when a patient lost coverage, and you're looking at the $70,000 write-off, and, it may feel like this fluke edge case that you don't have to worry about, but it is the thing that is the most risky and most impactful to your business. And so how do you think about those small things that are actually becoming much larger boulders in your business than you've identified?
Yeah, I think of like chasing down denials, like the whole denials thing, right? Because even when you're outsourcing for billing, we have a lot of owners that will tell us, I can't get my billers to like keep chasing the denials.
Yeah.
Like no one seems to care about these denials, but meanwhile, these denials are just building up.
Yeah. But yeah, like I just, I imagine, again, just going back to that administrative, this is the lowest of the lowest low-hanging fruit, right? Like, it's just like one day it's there and the next day it's gone, right? And it makes it, like, it gives you that ability, especially like that one BCBA business owner that's doing all the hats. It's like one thing that you can pass off confidently. And there are a lot of things that are very scary to hand off, right? And this one doesn't. I don't feel like it is.
Well, that's because we've gotten to know Jeff, and there's these guys at SILNA Health, so I think it might be a little easier for us to say that because it's not new to us.
Sure.
But I definitely think that even if that's what we were saying before, if we still had our ABA company, heck yeah, sign us up.